Hello friends, welcome to Pharma English. This is RK. Today we have to discuss about the disease called tuberculosis. Many of them know more about the TB. In this topic, we briefly discuss about the causative organisms of TB and symptoms and how they can spread and how they multiply inside the body and how we can prevent from the tuberculosis. Let's enter into the video. Tuberculosis is an infectious disease caused by a bacteria called Mycobacterium tuberculosis, which is primarily affect the lungs. It is called as a pulmonary tuberculosis. Other than the lungs, it can also affect other organs in the body, which is called as extrapulmonary tuberculosis. As per the global report of 2021, it is estimated that the TB in India have 188% can affected per 1 lakh population. This is high. Classification of TB based on the treatment. It is classified into pulmonary TB, extrapulmonary tuberculosis, at multiple drug resistant TB, and extended drug resistant TB. Pulmonary tuberculosis is simply when the tuberculosis infection only affects the lungs, it is called as pulmonary tuberculosis. When it affects other organ other than the lungs, it is called as extrapulmonary tuberculosis, which includes uh, liver, UTA, urinary tracts, and bones, spleens, etc. Multiple drug resistant tuberculosis means when a tuberculosis infection shows a resistance to the isoniazid and or rifampicin or first line drugs is called as multiple drug resistant tuberculosis. What is resistant? Resistant means when a organisms does not show a effect when we inject a drug. It shows it further multiplied and not responding to the drug is called as a resistance. What is a extended drug resistant tuberculosis means when the tuberculosis infection shows a resistance to isoniazid, rifampicin, and fluoroquinolones such as ofloxacin, levofloxacin, or moxifloxacin. Along with it, also show a resistance to the second line injectable drugs like amikacin and kanamacids. This type of tuberculosis is called as extrapulmonary extended drug resistant tuberculosis. Next, what are the causative organisms of tuberculosis? Other than that, the Mycobacterium tuberculosis, there are Mycobacterium bovis, Mycobacterium canasis, Mycobacterium avium, Mycobacterium africanum, Mycobacterium mycotic, Mycobacterium caniti. These are all also causes tuberculosis. Next, mode of transmission. In humans, TB infection is affected can transmitted based on the following four ways. First, inhalation method. In this, a fresh droplet can enter into the healthy person from the infected persons through the inhale airways. At the injection method, in this, when infected when a mycobacterium tuberculosis enter into the person with accidentally intaking of the organism through the infected sputums, or when through the milk of the cow when the cow is infected with the Mycobacterium boviana. Is the common infection affects the cow which produces the TB in human beings. At the inoculation of organisms into the skins and rarely occur in the post-mortem tissues. When infected patient tissues is inoculated with the tuberculosis infection, when it is entered into the healthy person's skin, it get inoculated in the skin and then spread into the person. Next one is transplantal route, which means spread of tuberculosis from a mother into the fetus during the pregnancy condition is called as transplanted mode of transmission. Next one is pathophysiology. When a TB infection is get a aerosol through the inhalation, it enter into the alveoli of the lungs. In the lungs alveoli, it get started the initial infection into the macrophages, and then it further form into granuloma. Once the granuloma is formed, it gets spread into the lymph nodes. In the lymph nodes, the infection is further multiplied and enter into the bloodstream. After the entry into the bloodstream, it can spread through the entire body and produces a extrapulmonary tuberculosis. Only it is spread into the lungs, it is called as a pulmonary tuberculosis. Next one, spread of TB. The spread of TB inside the body is classified into four types: local spread, lymphatic spread, hematogenous spread, and by natural passages. Local spread, when the macrophages is passed into the lungs and only affect the line from the lungs and affects the surrounding tissue is called as local spread. When it enter into the lymph nodes and use the lymphatic systems and it is spread into other organisms like bronchioles pharynx, larynx, and intestines is called as a lymphatic spread. When the microbacterium tuberculosis enter into the bloodstream and use the blood vessels to further transport to other organs of the body. This type of TB is called as a miliary tuberculosis. This can affect any of the organs in the body like kidneys, bones, livers, and other tissues, etc. Next, natural passages. The natural passages have a two route. First one is lung lesion into the pleura. The transmit of TB from the lungs into the pleura region, which is the surrounding tissue covering of the lungs. Next one is transbronchial spread into the adjacent lung segment, which means when a TB is spread into the one side of the lungs, which is transmitted into another side of the lungs, it's called as a transbronchial spreads. Next one is types of tuberculosis. TB is majorly classified into pulmonary tuberculosis and extrapulmonary tuberculosis. Pulmonary tuberculosis is further split into two types: primary TB and secondary TB. Primary TB is defined as when a patient is for the first time is infected with the tuberculosis is called as a primary TB. When the person have a recurrent TB or reinfected TB is called as a secondary tuberculosis. It means the patient is already experienced the TB infection and take a medicines and cured, but the infection is reappears and the patient is called as a secondary tuberculosis. Next, extrapulmonary tuberculosis. It is further classified into lymph node TB, which means the TB infection affects the lymph nodes of the patient around the neck region and causes swelling or infected in that area. At the pleural TB is a pleura is a region which covers the lungs and protect it from osmotic pressures. When the region is affected and they shows this fluid accumulation in that area, which is called as a pleural effusions. When the TB affects the meninges layer of the brain, spine and brain is called as a TB meningitis. Next one, when it affects the bones and joints of the person and produces swelling and pains, it is called as bone TB. When it affects other places, it's where it get affected, then is called as a when it affects the liver, spleen, or bowels, it is called as abdominal TB. When it affects the kidney, bladder, or urinary tract, is called as a genitourinary TB. Next, symptoms of pulmonary tuberculosis: fever, night sweat, prolonged cough, weight loss, shortness of breath, tiredness, and loss of appetite are the most common symptoms of pulmonary tuberculosis. When compared to the extrapulmonary tuberculosis, it can be varied based on the type of extrapulmonary tuberculosis. For example, of the lymph node TB, enlarged cervical lymph nodes and fever is just a common symptoms. For pleural TB, fever, non-productive cough, breathing difficulty, and pain on deep breathing is the major symptoms. On CNS TB, fever, headaches, convulsions, nausea, vomiting are the symptoms. For bone and joint TB, pain on the joints and difficult and daily activity is the common symptoms. And how the TBs are get diagnosed? They are diagnosed based on the following 8 methods. First, smear microscopy test, chest X-ray, culture methods, tuberculin test, molecular test, nucleic acid amplification test, FNAC method, and CT scans are the commonly used methods for the diagnosis of the TB. FNAC is specifically used for the extrapulmonary tuberculosis. Next, risk factors. Who are all in the risk regions for having a tuberculosis? First one is age and elderly persons. Next one is immunodeficiency diseases such as HIV. Next, immunosuppressive intaking patients for the diseases such as kidney disease or other autoimmune diseases such as arthritis. Overcrowding is one of the factors where the TB can easily spread from one person to another. Next one is contact with the TB patients can easily spread from the infected to non-infected person. At alcohol intakes and the diabetes mellitus have suppressed the immune system of the healthy person and provide a chance for the tuberculosis. Next one is kidney failure. This is also one of the major factor for the tuberculosis. Next, patient counseling for the TB patient. What are the preventive measures have to be taken when the TB is entered into the body? First one, patient should be isolated in a separate room. The surgical mask should be wear by the patient, and when they should cover their mouth when they have cough or sneeze. Skipping the tobacco in any forms when they have intake, which can affect the immune system and affect the treatment of the tuberculosis. Fruits and vegetables, healthy fruits and vegetables should be intaken by the patient to boost the immune system. Some nutrition such as vitamin A, C and E are very effective in the TB patient, and increase amount of protein and also support the immune system. For advise them to clean the rooms with the disinfectants, and advise the relatives or the patient when they are get interacted with the infected persons. These are all the supportive measures for the curing of the TB. The primary measures is they have to, when they have suspected or feeling the symptoms of the TB, they should primarily consult a doctor and taking the anti-tuberculosis therapy, which can help them to completely relieve from the TB. This along with the medication, these steps have to boost their effect to cure them from the TB. Thank you. If you like this video, share this to your friends and subscribe to the channel Pharma English. If you need any other topic, please mention in the comment section. We'll see in the next topic.